My guest today initially appeared on this podcast back in episode 31, which was released in March of 2018. 6 years later, almost to the date, she returns to share updates and also help me have an important, but not always easy conversation. You're listening to the PHEC podcast, episode 345. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. I'm super excited and a little bit nervous because this episode is going to take me down a conversation path that's still a little sensitive, but I think it's really an important conversation to have. I've shared with a lot of my colleagues about the topic of caregiving. And as a lot of us are caring for our elderly parents or on some part of that journey. You may think that it's really far into the future, but we never really know when that kicks in, or you may be in the middle of it right now trying to navigate things. And I shared on this podcast, I guess at the time of this recording, go back roughly 6 months, my mother passed away. She lost her battle with cancer. And I shared about that a little bit on the podcast. And in private conversations, I've talked to my friends about just the challenges. And what's interesting as public health professionals, I said this before, but we are all aware of it. We're giving and caring about our communities and everyone else. And we often will put ourselves last or not recognize the needs that we have in our own personal lives and taking care of ourselves. So some of these topics that my friends in public health colleagues would say to me, oh gosh, this is, I'm dealing with this with my mother or my father, or I just recently went through that. And I would make a comment like, I would love to share this on the podcast sometime. And they would say, oh, I would love that. I think that would be so great. And I really wanted to do it, but it's been very difficult first of all, it's hard to think of it as like a solo show. I don't think I could have really done it by myself. And then I was trying to think of who would be the right person for this. And my guest today is that perfect person. So I'm really excited for a lot of reasons to have this conversation with her. So there's multiple layers of insight and value that I hope you pull from this conversation on the episode today. So on a very personal note, this is exciting because this is a friend that we went to grad school together and graduated together, a couple of rows apart on that day. And we've kept in touch over the years. She was on the podcast back in episode 31. And she and I were laughing about this a little bit before we started the recording because we remembered that episode. If you go back, and I'm not saying that you should, but some people go back and listen to the previous episodes when I mentioned this, you're going to hear some really glitchy technical issues with the audio. We found out much later what the sound was, but we had a hard time with some of the audio. And she kept saying, oh, you should just take that down. We'll redo it. But now, even though I cringe at a lot of my early episodes, I think it's just an indication. It's nice to see the real, I'm using air quotes, the real and raw side of getting started. It's nice at this stage to be 345 episodes in, 7 years of podcasting, to be, kind of floating along with systems and teams and forget about those humble beginnings and the rough edges around getting started. So I leave all the blemishes up in those early episodes because it's just a testament to the bumps and bruises you go through with getting started. However, all that being said, the content, what we discussed and the conversations were always high value. So even though there were some little technical issues here and there at the beginning, it doesn't matter because my guests were great. and there was always high value. So I'm very proud in that respect. But also, I want to say happy birthday to Dr. Hickman, because the day that this episode releases, now, of course, we record them in advance, but the day that this releases is actually her birthday. So happy birthday, Dr. Hickman. And thank you for coming back to the podcast and sharing. She's been up to a lot in the last 6 years since we had our first conversation. So her first episode was episode 31. This is now episode 345. That means 314 weeks later, because we publish our episodes every week. And that also equates to 6 years, almost to the date. Her first episode released on March 20th in 2018, and this one is releasing on March 26th of 2024. You know, I'm an epidemiologist. I can't resist an opportunity to put out numbers, but that excites me. We didn't plan it exactly this way. It's just that when we started to put it all together and started looking at those numbers and just realized the alignment there. Okay. Enough of my babble, but I am just excited for you to hear the conversation. I'm going to introduce her to you, and we will be sharing a lot about, like I said, on that personal journey. It's not necessarily been the easiest thing for me to find a way to bring up some of what I learned in some of my journey as a caregiver for my mother. But like I said in the early part of the introduction, I'm excited to have Dr. Hickman navigate this with me, have this conversation, because she has written 2 books, not just one, but 2 books since she was on our podcast before. And that's her focus. That was also her journey and her experience. So she shares a lot of that in our conversation. And then as a result of that, and as we're talking, I share little glimpses, little personal tidbits from my journey with my mother as well. So lean in. I think there's something for everyone in here. Do not tune out if you think that that's so far away in your future. I wish I had this information 10 years ago. I wish I had been listening. And it's not that it's brand new. It's just I wasn't paying attention 10 years ago. And I wish I had. There are things that I did really well. And there are things that I've learned from my experience. And I'm listening to Dr. Hickman and the resources that she's going to share. I really encourage all of you to listen and pay close attention, even especially if you think it's so far away. You especially need to be leaning in for some of the things that she's going to share. Okay, let me introduce her to you, and then I'll connect our conversation. Dr. Cynthia Hickman is a retired care manager practicing at St. Luke's Episcopal Hospital in Houston, Texas. She has completed a Master of Nursing specializing in education and a PhD in health services with a leadership specialization. She's also a part-time faculty member teaching evidence-based nursing. Dr. Hickman is the author of 2 books. The first one, From the Lens of Daughter, Nurse, and Caregiver, a journey of duty and honor, sharing her 20-year journey of caring for her mother, as well as the Black Book of Important Information for Caregivers, which details the necessity of mindfulness of the business side of being a caregiver. Now, we will provide links to both of these books in the show notes and how to connect with her. So I'll tell you about all of that a little bit later. Dr. Hickman founded the Socks for Seniors Community Project in Missouri City, Texas in 2020. And as of 2023, has given over 1,600 pairs of socks to nursing homes and assisted living residents in her community. Last year, she received support from Bomba Socks, an apparel brand company that donates socks to community programs. Dr. Hickman is a keynote speaker and has spoken nationally, sharing her powerful story of caregiving and resilience. She is passionate about education, caregiving, and strategies to help others navigate life challenges when caring for aging loved ones. It is my honor to connect our conversation right now. Well, I am excited to have my sweet friend back with me on this episode, Dr. Cynthia Hickman. How are you?
I'm doing well. How are you, Dr. Huntley?
I am.
Long time no see. Long time no talk to, huh?
I know. Okay, so just in case y'all didn't catch that, she also serves as like a big sister role. So, no talk to. We haven't actually talked in a little while. It has been a little while.
Yeah.
But we go way back. We were in grad school together, graduated together, and she has also been on the podcast. It's been way, way, way long time ago. I have to look it up and see how long it's been exactly. But I am so delighted to have you join me back on the podcast. And thank you for being here. Welcome back.
My goodness. It's a pleasure. It's always good to see you. You know, like you say, way back. And we don't have to talk every day to know that we're still connected. So that's what I like.
That's right.
The fact that we have relationships and we don't have to talk every day, call every day. We can just know that we're in each other's heart. And that's special.
That is. I get that random
so
text with some hearts and glitter from you. And I was like, oh, it's like getting a hug.
Yeah. So good to see you and be with you today, indeed.
Thank you. Well, for those that don't know you, why don't you introduce yourself and tell everyone a little bit about you?
Well, sure. So I'm Cynthia J. Hickman with the PhD, so you can call me doctor. I worked for it. Originally from Toledo, Ohio, registered nurse by profession, did many years as a registered nurse, transitioned into case management with my nursing career. So I worked with families on the discharge planning side of nursing. And then I retired in 2013 to take care of my mom. So my mom was living with me and I took care of her for 20 years. I became a full-time caregiver. Mom passed in 2017 and I turned that journey into an advocacy program to help me with my grief. So I am your proactive caregiver advocate. And that is a platform of speaking. I keynote speak on the topics of caregiving. And then I'm an educator as far as the topics that impact elder care. So that's who I am. And I'm just glad to be here.
Wonderful. We're going to dive into all of that, which is a lot, but we're going to dive into all of that in this episode and really peel back some layers and share some vulnerable moments with all of you. But I think it's a really important topic for us to have, especially in public health, because we're give. And this is the time for us to kind of sit back and receive a little bit in terms of, how we can prepare and kind of look ahead. So before we get into all of that though, let's talk about your journey. I love to know where you are now and to hear about all those things, but I think it's important to hear that journey. And so with that in mind, I'd love to kind of go back a little bit. So let's go all the way back to the time when you first learned about public health or first considered public health as a career. Tell me about that.
Well, believe it or not, I think I've known about it as a youth. I don't say youth, but teenage years. My teenage years was about healthcare, lifeguarding, and first aid. And we did it on a community base. And I really never connected the public health aspect of it. But when you think about it, the public is who I was serving. And so when you think about it from that perspective, the reality is that community health, public health is so connected that you really can't do one without the other. So my first journey was first aid, being a lifeguard at a swimming pool, serving the public when the kids would fall and scrape their leg, the Band-Aid, here I come. And then, of course, as I aged and grew up and recognized nursing and healthcare was someplace I wanted to be, it just went along. And so, of course, my educational journey, the nursing aspect of still people in the public that now come into my community of a hospital, and now I'm serving them in capacity of healthcare. And then, of course, I did a lot of caring outside of the hospital. So therefore, I'm still in the public, still educating. So when I would do workshops and little pop-up topics with people on the different aspects of healthcare and problems that we have in the public, it just kind of evolved. And of course, it kind of fell into the elder care perspective because, of course, I was dealing with my mom. And it was really important that elder care needs to be a public health issue. I'd hate to think that it's a crisis, but I saw a crisis during COVID when we had many people in facilities that families could not see. There was many things going on. And then, of course, the hospital, the same thing. So when I think about the public health perspective, I can say honestly, as a youth, I didn't know that's what it was called, but I know that's what I was doing. And as an adult now and practicing, I see it now that it's the relationship of public health has to do with serving the people in populations that need attention, specifically ones who might be vulnerable, because if we don't, who will?
Right. Now, I think I know the answer to this, but Is there a particular population or condition that you are most passionate about right now?
So if I think condition, I will say health related issues that cause elder care to have problems with safety, nutrition, and health. And I've used those three because they kind of come together. I'm concerned with the elder care population who is not able to manage their own care. And so they need a caregiving perspective, who may not understand their medication, so need a caregiver perspective. And some of those things are not automatic. People have to understand why they're doing what they're doing, while they're taking what they're taking. Because a lot of times the older people used to just do what the doctor said. And so in doing what the doctor says doesn't necessarily mean that they understand what the doctor is asking them to do. So I spend a lot of time helping people understand, explaining these type of techniques so they can care for the elders. So I want elders to age in place because they do better when they're home in their own environment with people that love them and know them. So I'm very big on aging in place.
Nice. Yeah. I am very familiar with the concept from firsthand experience. I mentioned when it first happened and then across a couple episodes, I lost my mother the end of last year, and the years leading up to that, I was sort of the lead on her care. You can call it the team. I have siblings and all of her doctors and, healthcare team. I sort of took the lead on trying to help her understand. And you're right. There's so much that she did because she was always, her doctor said to do this a certain way, and she would get very involved but there's always so much, there's these gaps in what she understood, and she just kind of did what she was, told to do because she just trusted. So I did a lot of explaining, and then it was important to her to remain independent. She wanted to live by herself. She lived 10 minutes away from me, but the idea of moving in with me was just like, that wasn't something she ever wanted to do. And it wasn't that she didn't like me or anything. It was just that she always wanted to be independent. It was very important to her. So we did what we could do to allow her to age in place. And she remained, independent, even up to managing those last days with the fight with cancer. And so I definitely can understand that importance. And, as I've shared with some of my friends and colleagues, especially those in the field of public health who are at this journey of maybe taking the lead of their elderly parents or their parents who are fighting some illness and they're having to deal with that. Because I said a while back that I would love to do an episode where I could share a little bit more about my journey. I had to first get a little strong to where I could talk about it without falling apart. But every time I brought up the idea, they were like, oh, I would love for you to do that. That would be so helpful. And I think it's because we're just always in that position of thinking about everybody else, doing everything else. Our elderly parents and being a caregiver can sneak up on us. Mm-hmm. So retrospectively, I look back and I see where we did a lot of things really well and we were really ahead of it. We were really proactive. Mm-hmm. And then I can see where there were a lot of times we were reactive.
There's a word, Dr. Huntley, that I often share with people. I say to them sometimes when I have my talks, the first thing I say, how many of you have taken the blinders off as it relates to your elderly parent? And it kind of like they don't really know what I'm really asking them. And so I use examples like, if I'm 40, your parents are probably 60. If I'm 60, your parents might be 80. What have you all seen in these 10-year gaps that might be something that you might need to pay attention to because it may show up? And if you're paying attention to these things, then you're not as surprised when something happens. And we're using some of the chronic disease examples when we in a family who may have we'll use diabetes. Diabetes is genetics. We can't do anything about genetics, but we can understand that this may come down our street. And if it does, then we can kind of be more prepared to do things differently, right? Or you go to the doctor and the doctor says, well, you have pre-diabetes. The word pre should give all of us pause to give us an opportunity to go back the other way. But we don't pay attention to that. We wait till something happens. The doctor said, do this, because as long as you're on the pre side, if you're pre-hypertensive, if you're pre-diabetic, what can we do so we don't end up in that shape, right? So if we end up in that shape, genetically speaking, well, we're not going to beat up on you about that, but we are going to say there's things you can do to control. I don't want your leg to cut off and then you miss that your leg is gone. If there's things that you can do. So that means maybe you need to pay attention to foot care. Because if you wear tight shoes that hurt your feet and they get sores and you don't pay attention to your feet, you get an infection, this, that, and the third. And where you are is a place you don't want to be, right? So when I say take the blinders off, I'm saying look around your family tree. See what it is that you may see might come knocking on your door. And what are some of the things that you can do to avoid it? Because if mama has it, you first need to take care of mama and daddy, auntie and uncle. But then by taking care of them, you're showing and you're preparing to the things that you might have to do if it comes your way.
Yeah.
And I think that's so crucial. And we don't do that because we live in a reactive society.
Yeah, that's true. That's true. Tell us a little bit about, I'm going to flip it, but it fits right into kind of what I was talking about, what you're talking about. More about what you're doing right now, because I know you have some great resources and you mentioned the speaking. What prompted you? Tell us about that, the books first. Let's talk about that. And what prompted you to write the book?
The first book, From the Lens of Daughter, Nurse, and Caregiver, A Journey of Duty and Honor, was a book I wrote about the journey of me caring for my mom. Now, interesting enough, I tried to write the book when she was still living. It didn't work that way. And then I later found out that was because I had to write the most difficult part of the book first, which was the hospice, the transition, her funeral, and all that. So I actually wrote it backwards. But the book is a journey of caring for my mom. The first thing was moving mom from Ohio to Texas. She lived in Ohio 60 some odd years. That's where she went to work. That's where she went to church. She attended a church there for over 50 years. And all of a sudden, she lived in a house that had a basement. The washer and dryer was in the basement and mama's knees were getting bad. And so we started paying attention to this is going to be really serious. And mom lived by herself as well because daddy died when we were 11. So mama raised us on her own. But as we looked at how her house was and how she was getting bad knees and aching, we knew something needed to change. So we moved mom from Ohio to Texas. But this is how it happened. When we started seeing this, we would have mom visit. Come to Texas, check it out. She was still with me. I have another sister here. And so we started her visiting first. We didn't just snatch her out of her house and say, you old, you got to go. We didn't do that. So we gave her a chance to see what it would feel like to move to another place. So that took some time. So in the book, we talk about the journey from Texas to Ohio because it's important to know when an older person has been in their own environment for all these years, just pulling them out can be very traumatic. Mm-hmm. So it's important that you ease them into it. So we did that, which is helpful. So the book then tells that journey of that, the things that happened when she was here. A funny story when we were in school together, Charlotte, I don't know if I ever told you this. One of the way I tried to keep her cognitive mind going, her fine motor skills going. Chapter 3 of my book, I gave to my dissertation. And my mother was an educator. So my way of keeping her reading, keeping her mind sharp, I gave her my 3rd chapter of my dissertation with a red pen. Now I'm thinking to myself, and I had looked at this thing a zillion times. So to me, it was fantastical. No problems. I could turn it in. The chair would be so excited. Listen, Shirley. When Shirley gave me back that book, that chapter, it had more red marks. The ink and the pen was gone. I said, Lord have mercy. And then you know what I said next? You won't get another chapter. But that was my way of keeping her active and reading and writing and stuff. That was funny. So that's the fun part of it. Took her to a museum because mom was a teacher, like I said. So we went to an area where you could put round pegs and round holes, square pegs and round holes. Because again, I'm trying to keep mind and fingers going. And I noticed that mom used to she would slide the pegs into the hole versus like really putting them in. And I said to her jokingly, you're acting old and I'm going to put you in somewhere if you keep acting old. But what I really saw, Charlotte, is that her vision was going. I never told her that, but I noticed that she was not connecting because her vision was going. Later found out she had cataracts. I was paying attention.
Yeah.
Because I knew what she used to do.
Right.
And I saw changes. And so that's the importance of aging in place, because sometimes you can see these things that happen.
Mm-hmm.
So the book tells a story like that. So I turn it into a story, but what it really is saying is, when you read my story, this could be your story.
Mm-hmm.
Your mother could have vision problems. Your mother could have bad knees. She could have bad joints. Her vision may be bad. Her hands may be arthritic. So when you're reaching up in the cabinet to get something, something could fall out, break, and she could get hurt. So my whole mind is about safety and environment and paying attention, because the goal is you don't want anybody to be hurt.
Right.
So safety is so important as people age in place. So the story kind of goes like that. And then the last chapter actually talks about informal and formal caregiving. So I was an informal caregiver at home, but in the hospital where I worked, I was a formal caregiver, nurse, and so the distinction between being in a hospital where you push a button and 20 people come and being at home and it's you, yourself, and I, and ain't nobody coming at 3 a.m. It's you. So it's a very nice story of these are the things could happen in the caregiving space, and I wanted to share it with everybody. So that was book one.
I love that. And I'll make sure that we provide links to it in the show notes. And I recommend it because, listening to you, I think it's the type, and I did not get to read it before I went through this process with my mom, but listening to you, I recommend it. I think for people way before you think you need it.
Right.
To read and to pick up on things that you can watch out for, and then to already have it on hand in case you find yourself in the process and you want it as that great reference book.
Right.
Because those stories are how we resonate. And maybe you may read it one time and it doesn't stand out to you, but 2 or 3 years later, when you're at a different stage of life, it can really sing and ring out to you.
And believe it or not, someone said that to me. They read the book and they said, "Oh, I wish I'd have read this book 2 years ago." Because what it did was help them recognize that they weren't paying attention.
Yeah.
And they talked about one story of their dad falling because they looked at I think the dad had a walker and the walker wheel, one of the wheels was off or something like that. And so dad, because he still didn't think he needed it. You ever seen people hold the walk and walk with it? It's not even on the ground. But the reality of it was he was doing that because it wouldn't roll. Because there was a wheel missing. So if he'd have put it on the ground, he may have failed, right? Because it's uneven.
Right.
And so he said, "I wish I'd have read your book back then."
Yeah.
I said, no time like the present, because you start where you are.
Yeah. I remember when I convinced my mother to move from Mississippi to South Carolina because I wanted her to be close to me. And that was, let's see, maybe it was right after her 70th birthday.
Okay.
So a few years after that, so early 70s. And I knew as she aged, I wanted her to be closer to me. I knew she wasn't going to live with me, but I wanted her to be close. So I shopped. She was already in the habit of traveling to see us often here. She loved to travel. But here, as opposed to the small town that she was in, I'd listened to her complaints about things that she liked to do and what she was restricted. And so I sold her on, you can do these things here. And I kind of solved for that here, and that helped to make an easier sale. But I took into account all the benefits and all the things, the little things that I knew mattered to her. I tried to account for all those things. So I didn't tell her she had to do it. Like you said, you don't just say, "You're old, you got to do this." But I just stacked everything in favor of her, make it easy for her to say yes. And then she got excited about the move. And then once she was here, now I think about the last probably 4 or 5 years, there are so many things that I could catch up with because we had a meeting, a coffee date every Saturday. And that was so that it was as I was building my business. So when at the very beginning, those early podcast episodes, I was trying to explain to mom what a podcast was and and I would go over and I'd play it on my phone and let her turn the app on and let her hear an episode and we listen together. Or I take my laptop over there and I tell her about what was happening in the business and she gets so excited and be so involved. And it allowed me to just be with her. I could put eyes on her, be with her in her environment and see. So I could watch things shift. I could watch how she changed. Those little things that you pick up on just from being around her. And my siblings all lived at a distance. So when I started to notice certain things, they didn't necessarily notice because they couldn't see her. So you could talk to her on Saturday morning. She could sound like this, and this is great. And then an hour later, she could be in the bed, which is odd for her. And, it allowed me to spend time with her and those little things that I would just notice and pick up on. And I didn't even know I was doing it right back then. I was just.
Absolutely. But you see, that is so important that you release in nursing, they teach us about assessment skills, observational skills. And one of the things I talk about sometimes is I never let mother know I was watching her.
Yeah.
Because they don't want to be policed.
Right.
They don't want to feel like they're old and they need you to watch them.
Right.
So, I never did a lot of, okay, Mom, I'm watching you, because as much as we can, I worked so hard to allow her independence. Just like as you state, it's so important when they already feel like they're losing a part of their independence, right? You spend as much time as you can trying to make them independent, let them be independent to the things that they can.
Yeah.
And then when you see safety becoming an issue, then you have to step in because again, we don't want them to be injured. And when you think about it, Dr. Huntley, really the whole reason why we should love on our loved ones is seeing them hurt and injured because of something that we could have done is a feeling that nobody wants.
Right.
Here in Texas, there was a situation of a family who had their granddad in a nursing home. And as the story goes, the granddaughter felt the need to put a camera in the nursing home room where the granddad was. Because everybody's living life, they're going to work, they're doing what they're doing, and probably they couldn't afford to not work. But the mere fact, I think what really got me the most was the fact that they truly felt the need to put a camera in their granddad's room. To me, that was a red flag, and I didn't even have to know the man. Right? So, of course, that particular day or however it happened, two of the nursing assistants were very gruff with the man, very mean to the man, pulled him out the bed. He fell on the floor. He broke his hip. I mean, just and all this was on camera. He ended up in a hospital and he subsequently died. Now, of course, I'm furious at the nurse aides, right? But I think I was even more furious at the granddaughter. Because just the fact that you felt the need to put a camera in your granddad's room should have been the reddest flag that you've ever seen. And I just couldn't fathom what you were supposed to find out about that. And you got what you found out and it wasn't good. So I just say that because even in our best effort to care for our loved ones, we have to avoid the reactive behaviors that we do. Because they're costly. And in the same hand, when you put someone in a facility, you expect them to give your loved ones care.
Right.
That is the expectation. And anything other than that, of course, we know is unacceptable.
So that example with the camera is a reactive action because she already there's something that prompted her to. So I don't know if I'm moving now to the second book, but which one of your books then I know would help with guidance on how to navigate this part of the journey when you're actively caring and providing the, what to do and how to set it up and how to find the right facility and what happens if you need to move and things like that. Is that the second book?
The second book is about the business side of caregiving. And to your point, yes and no.
Okay.
Finding a facility takes effort because no two facilities are alike. The people who work in them, we don't know. You really just have to do your due diligence and your homework, and you have to show up. The Black Book of Important Information for Caregivers has a portion in there about respite facilities if you need to get away, if you're caring for someone in the home. And the facilities that are available to allow you to have respite are out there. I actually put my mother in one. That was the worst week of my life. I put her in a respite facility because I wanted to go to my friend's 65th birthday party in Ohio. And I wanted to take my husband with me, and I kept trying to figure out what I'm going to do with mom. So my daughter actually worked at a facility at the time. She said, well, Mama, let him come to my facility. And so I thought about it and prayed about it and cried about it and cried about it and prayed about it. So he eventually made it happen. Listen, Mother had the best experience at this facility. The administrators called me every day. They sent me pictures of mom learning French. They did French classes. They did crafting. They did bingo. They did walks in the park or whatever they were doing. Mama said, well, if you ever put me in a home, put me in this one. I'm like, okay. But Charlotte, the first 2 days I cried.
Yeah.
Because I was just worried about who's going to do this. And when I did the application, I said and I'm paying for this, 2 attendants at all times to help with the bathroom because, she was kind of stiff with her knees. She could stand up a little bit, but the pivot was some kind of strain. So you need people on both sides. So when the lady told me when we took her, well, this is Sally Ann and Sally Ann is going to take care of mom. I said, and where's Jane? And where's Molly? I said, cause, we need 2 people here. Right. And so, she kind of chuckled. I said, I'm not chuckling.
Yeah.
So that was important to me. So they figured it out and fixed it and all that. But I cried because I didn't know what to expect.
Right. Yeah.
But they fooled me and I was so grateful and mom had a great time. And when I left her that time shot, I'll never forget it. Mama said, y'all coming back, aren't you? She said, y'all coming back, aren't you? I said, I'll be back.
Well, that facility is great because they, that connection, the information. We had to do this with my husband's, my husband lost his mother earlier last year. So before I lost my mother, but his dad was thinking about coming here and we were looking for a place for him and we toured a few and talked to some people. And you're right. To get in there, you need to talk to some people. We were both like, I was looking at through one lens and my husband was looking through a different lens. And there's just things you have to put a little time and a little effort in. My father-in-law ended up not moving up here, but I did go through that part of the process of trying to find things. So I'm going to make sure that we provide links to both of your books in the show notes because I recommend starting with number 1, starting with the first one and the stories and then progress to the next one. And just depending on where you are in your journey. But if you're at a place where you think, oh, that's so far away, then get the first book and go ahead and read that. That's what I would.
But you know what? Sometimes I would say, Dr. Huntley, sometimes the second book might be more important than the first book because what happens is when you need to have information, then you're trying to get it and you're in this state of confusion and you're in a state of grief if you're on that side, or you see someone transitioning and you have to decide about hospice. You don't have your documents in place. You don't have information in place. You don't have insurance in place. You don't have, if they're at death, military people, the form DDD 14 is important to have because you can bury them at no cost because of military. I mean, all these information document wise, sometimes you need to have them. And, in our era, Mama had documents, they were tangible. And although we're electronic, some people need and require tangible documents. So it's not a bad idea to start looking for them now.
So the second book is what helps with all of that. Okay.
The second book helps with that. Okay. Yeah. And you need to have them because even funeral homes, they're not going to look at your phone and look for.
That's true.
They're not doing that.
Been through that.
Yeah. So it's kind of go to bed. You kind of like, again, if you're proactive and you don't look at it, oh, somebody's going to die. You look at it as being prepared. Right. The more you're prepared, the better off you are because when grief happens, all this stuff goes out.
That's right.
It just goes out.
Yeah. I'm going to definitely link to that. And then I'm going to also, because I know the listeners in our podcast audience is a diverse group of listeners, I'm personally going to really lean in and highly recommend if you work or leader of an organization that could benefit from having this type of discussion in a group setting, a workshop. I recommend that you connect with Dr. Hickman and explore having her come speak and lead a workshop at your organization, your community, and just help this message get out to people in these resources be available. I think this is just really important. And thank you for coming and talking about it.
Well, thank you, Dr. Huntley. There's another interesting concept that I was thinking about when you mentioned that, because when we are in the workforce, we know we have to take care of ourselves and we know we have to work. So I often wonder what organizations are truly doing to identify their staff or their employees who may find themselves in situations like this. We have FMLA for importance when people need to use it. But what else do they put in place? Do they have a mental health day? Do they have a gift certificate day for someone who's a caregiver for their loved one at home? Something to let them know that we care versus just always working on your job to do what you do. Because that gives people hope to know that, yeah. And then really, there go I by the grace of God. Who's going to take care of you one day, or who's going to take care of your loved one day? And don't we all want to be taken care of in a way that we can feel good about at the end of the road?
Yeah, absolutely. So great resource for sure.
Mm-hmm.
Dr. Hickman, this has been fabulous time to catch up. I thank you for being here, not only the catch up and for being able to share this resource, but also helping me to be able to have this discussion, because I really wanted to share a little bit more with the audience, kind of just a little bit of what I've learned on this journey, and encourage you to be a much more proactive and not wait. So I really recommend the resources and connecting with Dr. Hickman on LinkedIn at the very least, and following what information she puts out and getting to her a little bit better too. So thank you for being here. I so appreciate you.
I have to share this last comment with everybody, with our listeners. I want everybody to remember we all are pilgrims passing through, and ain't none of us gonna get out here alive. So let's be proactive.
That's great, great, great final words. Thank you so much.
You're welcome. I appreciate you.
I really hope you enjoyed that conversation as much as I did. I've been wanting to share more of my personal journey as a caregiver with my mother with all of you, but needed the right person to have this conversation with, and Dr. Hickman was the perfect person for this conversation. I hope you found value in the insights that she shared with us. I encourage you to connect with her and explore both of her books for yourself. I think they make great gift items for friends, or consider bringing her into your organization to lead a workshop and help a group of your friends and colleagues, peers, all at the same time. We've gathered all of the links together in one place, and that's on the show notes page, to make it super easy for you to access and to connect with Dr. Hickman. Just visit the show notes page for this episode, which is episode 345. Go to phecpodcast.com, and from there, just navigate to episode 345 to find the show notes. One more thing before we go, please take a moment and share this episode with a friend. I'm sure that you know at least one person who would be interested in hearing this conversation. If you're listening in one of the podcast apps, then you can just easily share it right through a text or through social media. If you're at the bottom of our show notes page, or if you're on our website at the show notes page, scroll to the bottom and you'll find social media sharing buttons, which also make it really easy for you to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.